Do have the trend of higher. You have anyone zooming in who's gonna be presenting?
No.
Okay, yeah.
The
videos.
Yeah, just the videos within the, but it's all on deck. We do that. We saved it on that Thursday.
And just to confirm, we still don't have Jared's screen. And to share this out. Okay, you're good.
Oh,
Okay, I just want to make sure it's all set. If you have no problems, you can take up the white phone right there and I will connect you directly to us, or you can just satellite.
Yeah.
We'll do it.
Oh,
Yeah.
Thanks for your help.
So this is my question. Is this semi or do we have to go there?
You can use either of them, just, it should have a light on it. That is very low. You're low.
Yeah, I had the same trouble in this one. Yeah.
Yeah, the.
Yeah.
You should be able. You should be able to use any of them, either of them.
Everything's loaded and then that's what you did. Yeah. Yeah, I
And so absolutely.
Yeah,
I think that if there is any. I think that would be helpful. Because also. Like talking to a session in the market next. Yes, if you're really focused on like. Getting like. For 100 time. That's when really good relationships.
All right, that should be, I think that's a little better. Does that
yeah,
sound-
that's much better. Yeah. Thank you so much.
All right, anything, just give us.
And if you want, thank you.
You don't have to.
Yeah, but I mean, I think I appreciate it. Yeah, these are gonna be there. It's just gonna be that.
Yeah, she'll pass it up.
To identify.
Sophia, you figured out like, Sophia, have you figured out passing the slide and over mail? That's.
Yeah.
Okay.
And then number one.
Oh, no, not yours. Do their thing. Where is Maggie?
And then also allow they're not very.
They're not working.
Yeah. Yeah.
Yeah.
And you guys.
So one of the few things to, we feel okay in the book, presentation, that's in hand to you. I tried to directly to know play rather than. I realize we didn't talk explicitly. So do I have to introduce her or like what's that? So I'll just mention it together and then. How difficult would it be to grab that QR code and then the slide and put it on this slide right now as people are coming in? To grab it. Yeah, I can.
Set up already.
Yes, we have.
We can put the second slide because we made a separate slide for the QR.
Yeah, we did.
Yeah, we took it from all the other
I
slides.
just think, already from that, people are coming in now, it's so easy. I'm gonna sit there so I can stand up and take pictures of you.
Thank you.
His latest read that it's like too small, you can shoot you. So one of them is like, why? What are you saying?
So as you're coming in, we do have a QR code on the screen just with, we're gonna use for helping to capture your questions. If you want to make sure you're accessing that, it's a Padlet. You can put a couple of introductory, we'll explain how to use it. If you used it before, feel free to throw a comment in there if you like, but just have it loaded on your phone, it'll help us.
Yes, what's that?
Shay, I'm a WASH program manager with World Vision US, and I'll be moderating the session today. So firstly, before we get started, a couple of you may have already scanned this QR code on your way in, but if you want to go ahead and pull out your phone and scan this, it will take you to a Padlet. If you're not familiar with that platform, it's very user-friendly. That's where we'll be collecting feedback and questions for our session today. So we have a number of different presenters, but if you want to go ahead and put questions in there as they arrive, I'll be monitoring that Padlet throughout the session, and we'll be selecting a couple to respond to at the end. So go ahead and scan this QR code real quick. I'll give you another 15 seconds or so. And this will also pop up again later. So if we have some latecomers or if you miss it, you'll have another chance to scan. All right. So without further ado, I will introduce the first speaker for today, Jenna Davis, to come on up and frame our session for us today. Thank you.
All right, I am very happy to have this job because I'm just going to sort of open things up and then hand off to the people who've done the real work. Let's see, right. So essentially, I'm also not going to spend too much time for making the case to invest in WASH in schools. I think if we're trying to move the needle on sustainable access to WASH services, there are lots of good arguments for investing in schools from a variety of disciplinary perspectives. You can serve more people at lower unit cost. You can have a big public health impact by attacking those hotbeds of infectious disease transmission that are schools. Anybody who's got kids knows this. And if we establish early healthy WASH habits, we're actually setting the stage for lifelong demand for services. So these are all good reasons to invest in school WASH services, but we only get all these benefits if they're good investments, right? We want to be doing the right thing. So for this group, what we mean by a good WASH investment is ideally one that is all three of these things. It's effective, it does what it's meant to do. And this, by the way, covers everything: curriculum, infrastructure, O&M, right? It's sustainable over the long haul, right, for the design life of the intervention. And ideally, it's also scalable, that there are elements, essential elements of that investment that could be relevant for other contexts with not a ton of additional investment that's required. So if you sort of think about those as our high-level objectives, let's think about what we know about them. So with regard to sustainable services, for me, WASH is like any other service, right? And if you think of it as a service delivery system, it rests on three key pillars. You need to have the right resources. That's not just money. That's also people, skills, water, whatever it might be, right? Land. You need to have information flows. People who are part of that system need to get timely, relevant, actionable information about their responsibilities and others, impacts, needs, effects, all of those things. And you need functioning accountability mechanisms, by which I mean people in this service delivery system are confronted with meaningful consequences, could be positive, could be negative, for the choices that they make. Yeah. So in this framework, all three of these are necessary conditions for sustainable services. You can't do it with just one or two. You need all of them. So that's sustainable. For scaling, you have to be mindful of what are the conditions under which your intervention, your investment was sustainable and effective, right? It doesn't have to be exactly the same context where you're trying to expand, but there are often these necessary conditions, and those had better match. Otherwise, you're going to need to make investment in adaptation. And this is a picture of a technology. And for example, this requires electricity. That's a very simple example. This could mean, though, that you need similar policies. Culture is a big issue, right? Accountability mechanisms, et cetera. So that's for scaling. And I've been in this business now long enough to know that we focus a lot on effectiveness in the kind of work, at least that I've been involved in. So I'll just take it on myself. And we're so concerned about our intervention or investment being effective that we are often unwittingly undermining sustainability and scalability objectives in this framework. How are we doing that? Well, we really want to be effective, so we add a little bit more technical assistance. We do a little bit more than we would, right? I see you smiling. I know you've done this too, right? We're hand-holding at the early stages to make sure we've got a win, we've got some success. But those kinds of supports are probably unsustainable in the long run. Information, we collect a lot of information, but for whom, right? It's often for me, right? I need to publish a paper off of this, right? So the data that I'm collecting or the information systems that I'm helping to set up are not the ones that are going to be needed by our partners in country over the long run. And, you know, this is also something we do. And this one I think is particularly important. Accountability mechanisms that are connected to partners, right, are not going to be sufficient to drive behavior in a system that you're trying to incentivize over the long run. So getting partners, whether they be research partners, donors, implementing partners, sort of off of the diagram when you're trying to think about what do we need for this service to run in the long term is really important, and I think not done very frequently. And essentially, this kind of projectized approach to getting something going, a new program or a new investment, often leads to this phenomenon that we don't let it fail, right? But because we're not letting it fail, it often makes it hard to scale or to last. And if anyone knows whom I should be crediting this quote to, please let me know at the end of the session, because I have looked high and low and I don't know where this originally came from, but I use it a lot. Okay. Moving right along. So armed with this kind of background, the folks on this slide, who are all right here, this fabulous team, are very clear-eyed about these issues. And we're going to hear from each of them about their experience trying to balance these objectives of making things effective, but also sustainable and scalable. And I think we're going to get to hear a little bit about the sausage making and things that are not working so well and things that work better. So I hope that you'll post lots of tough questions for them. Some of the questions that we have talked about ourselves and that sort of underpin the conversations we've been having, and some of the things you'll hear about are these, right? What does scale mean for your work and sustainability? How do you think about that early in the process as opposed to an add-on at the end, right? So in general, we're going to probe some of these issues about trade-offs between effectiveness, scalability, and sustainability. For the third time, if you haven't scanned our QR code, please go ahead and do that, because we're going to collect, Cindy's going to collect all of your questions and comments and synthesize them and get to as many as we can before we're out of time. Okay, and with that, I will hand off to Cindy. Okay. Cindy, thanks.
Thank you, Jenna, for setting the scene for the rest of our presenters today. So I will pass it straight to our next speaker, Christy from World Vision.
Good afternoon, everyone. It feels so official to have to stand behind this thing, but so you can hear me. I hope you had coffee with your cheesecake so you don't get too sleepy. I'm here just to talk for a couple of minutes. Well, first of all, I'm Christy Urich. I work with World Vision based in the United States. I am just going to take a couple of minutes to set the stage for our global focus on Washington schools, what we try to do from a global standpoint. But then the most interesting presentations will be my colleagues from India and Zimbabwe, who will talk more about what this looks like in their context. So first of all, if you know anything about World Vision, we're a global organization. We have WASH programming, significant WASH programming in 42 countries across the world. And in our current 5-year plan, which ends in 2025, we have, these are some of our aims regarding WASH in schools. I won't read them to you, but it just shows we're aiming to reach a lot of schools with water access, basic sanitation, hygiene, and of course, menstrual hygiene management services. All right, so when we think about WASH in schools, we put things sort of in 3 categories. We think about the enabling environment, behavior change, and of course, water and sanitation services. Again, speaking globally, super high level. So when we're looking at that, we think about policies and guidelines. We think about what is the capacity of local actors who are the ultimate duty bearers for WASH in schools. And this third one is particularly important and one we're learning a lot about, and we'll hear more about today, is around funding for operations and maintenance. Regarding behavior change, we do complement our service approach with schools with behavior change in schools, which we'll also get to hear about today. And we target a variety of behaviors, but these are the 3 that we always target in our WASH in schools program. That includes hand washing with soap, proper hygienic use of toilets, and safe use and disposal of menstrual hygiene materials. And then, of course, regarding water and sanitation services, we all should be very familiar with all of these things, having water on point or on premises or nearby, having gender segregated and disability accessible latrines that are equipped for menstrual hygiene management, and environmental cleanliness and waste disposal. Now, this is not easy. It is not a magic recipe or a silver bullet that solves all the problems, and we certainly have not figured it all out. These are kind of 3 areas of challenge that I chose to highlight. I'm sure my other colleagues in the room could highlight a dozen more. But a few things that I think are challenges we encounter in our WASH in schools programming. One is integrating across sectors. As a multi-sectoral organization, we're not just doing work in WASH, we're working in education and health and things like that. And sometimes because we're dealing with a variety of donor interests, geographic interests, different plans, it can be difficult to integrate with our sectoral colleagues. But I think we'd have a more maximizing approach when we do that, or we do have that. sustainable operations and maintenance, which is an ongoing challenge, that I already alluded to. And then I think this third one is also interesting is, we're working to provide accessible wash facilities in schools. But the challenge is often the school itself is not accessible. Either the building, the infrastructure, and of course, the education is not always accessible when you're talking about children with disabilities. So that's a disconnect sometimes. All right, so I have two colleagues here that are going to share their specific experiences. There's Swati Agnihotri from India, and then Nobushe Lachwa from Zimbabwe, who will be sharing their experiences. So I'm going to hand first to Swati and then move from there.
All right, thank you so much, Christy, and hi everyone. This is Swati Agnihotri, project manager for Wash Up India. And yeah, so I'll just quickly dive into the program. So Wash Up India is basically a behavior change program. We're targeting children as change agents, and it aspires to change the hygiene behaviors of entire communities through what the children are being taught in the WASH curriculum. We have the partnership which is here. So World Vision is the implementation partner in the program. We have Sesame as our curriculum development partner. The district administration is there. Of course, we need the government support to implement the project, and Stanford University and Oxford Policy Management as our research partners. So the intervention is basically, as I like to call it, a combination of hardware and software. So it's like a complete package in itself. The hardware being the functional wash facilities. So the intervention schools, we make sure that the schools have the right facilities for the children to actually practice the behaviors, right? So it won't make sense if you're teaching the children and they don't have the right facilities there. They don't have the hand washing facility or the toilets which are functional, which can be usable. So first step was to make the schools at the basic level of infrastructural upgrades to have functional wash facilities. And the second was followed by teachers training of the target school teachers for them to be trained into the WASH curriculum, which we have the materials here displayed on the table. You can see it after the session. And then, yeah, so this combines and turns up into a WASH up package. So during the program implementation, we did come across few challenges. I would like to highlight here two big challenges which were there. First is the frequent transfer of government officials. So I don't know about other countries, but in India, there is quite a lot, frequent transfers of government officials. You set a rapport with one of them, and then after 2 months or so, they're gone, and then a new officer comes in. So I think that was one of the biggest challenge. And second was, I know COVID-19 was a big challenge for all of us here implementing projects in field. So that was it. So how did we tackle those? I think government engagement at all levels is necessary. Many times we might just, talk to the big person at the state level and district level and not go down the ladder. But I think it's necessary to target the government engagement at all levels, because I've seen it from my experience. There's the transfers take place a lot at the high level, but not much at the lower level when you come down to the school level or the block level. So I think that really helps, because the officers who are at the school and block level stay for a few more years, and it helps for them to, to make it understandable for the higher chain officials to, that, okay, this is the organization which is working and this is the project, and, we can just support them to implement better. So I think that's really necessary. And so we've heard it from one of the block education officers in our target blocks. Let's see what they have to say.
हमारे ब्लॉक सकरन में 167 विद्यालय हैं, जिसमें से 41 विद्यालय का चयन किया गया था और 21 विद्यालय में शिक्षकों को प्रशिक्षण देकर वहां पर वाश अप इंडिया के अंतर्गत स्वच्छता से संबंधित कार्यक्रम लागू कर दिया गया। और विद्यालयों की अपेक्षा जहां पर वाश अप इंडिया के अंतर्गत 21 विद्यालय चयनित किए गए हैं, उसमें और सामान्य विद्यालयों में स्वच्छता संबंधित काफ़ी बदलाव देखने को मिला है। जहाँ पर प्रोग्राम चालू किया गया वहाँ पर देखने को मिल रहा है कि बच्चे नियमित रूप से हैंड वॉश का प्रयोग कर रहे हैं। शौचालय के बाद अब उनको हाथ धोने के लिए कहना नहीं पड़ता शिक्षक को, उनमें ये सारी अच्छी आदतें डेवलप हो गई हैं। और उसके अंतर्गत जो उनको सामग्री स्कूलों में मिली है वो भी काफ़ी बेहतरीन है। उसके वजह से स्कूलों में काफ़ी बदलाव मिल रहा है और बच्चों की उपस्थिति भी प्रभावित हो रही है।
All right.
Right, so this was one of the block officials. So even the block education officials at the block level have a set number of schools which they have to visit every month. So it's around 40 schools which they have to visit. So that was the experience which you saw in the schools after the implementation. So during COVID and after, the schools were shut down for almost 1.5 years in India. And after the things settled a bit and, some community programs aligning with the guidelines of the government, we were able to switch the wash-up school model to the community model. So there's a team taking the sessions in the community. And I think one very positive thing which came from this aspect was we were able to reach a larger audience, because school has a set of students which are attending, but we were never able to reach the students who were not able to make it to the school. So through this model, we were even able to reach, all the students who were there in a community, even who were not enrolled in those particular schools. And this is as a result of the completion of the project in the schools. We have Swachhata champions who, relate themselves to Ryan Elmo, who are the characters of the program, the main leads. So like happy faces of the children, I think it's really nice to see them. And this is one of our Swachhata champions. So let's hear it from them.
आइए अब हम आपको अपने स्कूल के स्वच्छता चैंपियन से मिलवाते हैं। ये इनका स्वच्छता चैंपियन का बैच है जो जब ये चैंपियन बनी है तब इनको दिया गया है। बेटा क्या नाम है तुम्हारा?
मेरा नाम है दीपिका, मैं पढ़ती हूँ कक्षा 2।
ये दीपिका है कक्षा 2 की छात्रा। ये हमारे स्कूल में जब प्रोग्राम चलाया गया था उसके बाद जब ये चैंपियन बनी है तो इन्हें ये बैच दिया गया है और साथ में इनकी बुक दी गई थी। टेक होम मटेरियल है जो चमचम बस्ती स्वस्थ और हस्ती। इस प्रोग्राम में हमको एक अच्छी चीज़ लगी कि एक बुक दी गई थी जो बच्चों को घर ले जाने के लिए दिया गया है। ऐसे इतनी भी ट्रेनिंग हुई है आज तक कोई ऐसा हुआ नहीं जिसमें मटेरियल मिला हो घर ले जाने के लिए बच्चों को। इसमें एक छोटी सी कहानी है चमचम बस्ती की जिसमें बच्चों में जैसे जैसे कहानी बढ़ती है इसमें स्टिकर्स चिपकाने के लिए मिलेंगे। जैसे ये घर है, ये कीटाणु बना हुआ है, ये कीटाणु है, बच्चों ने खुद कीटाणु बनाया है, ऐसे ही ये दिया गया है। इस बुक की सहायता से बच्चे घर ले गए हैं, इसको अपने माँ बाप को, अपने आस पड़ोस समुदाय में बच्चों ने इस बुक के बारे में बताया है और इस बुक में जो अच्छी आदतें दी हैं उसको और प्रमोट किया है। इससे बच्चों को सीखने में बहुत मदद मिली है और ये बच्चे घर ले जाते हैं अपने साथ में ये कहना चाहता हूँ कि इस तरह के प्रोग्राम जैसे व्हाट्सअप इंडिया हुआ है इसके सहायता से हमारा भी बहुत सारा ज्ञानवर्धन हुआ है, साथ में बच्चों को बहुत कुछ सीखने को मिला है। मैं चाहता हूँ कि ऐसे बहुत से प्रोग्राम और भी आगे भविष्य में कराते जाएं जिससे बच्चों को और भी सीखने को मिले, बच्चों को जानकारी बढ़े। ठीक।
Okay, I'm really sorry for the glitch that's happening. I don't know why that's happening, but I think you guys have, have an idea of more or less what they were trying to say here. So, yeah, so that was a take-home material, which is a very different material. I think what the teacher was trying to say here is that they have many software behavior change programs, but there was none where a particular material was given to the students, to take that home and share it with the communities, with their parents. So this is what the teacher really liked. And this is our Worship India team, where they've been trained as master trainers as well. So this is one of the scalability components where, this is now the Sesame has trained the trainers there in India, and they can take it up to another level and scale it up to another set of schools if the government is interested. So yeah, that's all from me, and you will see more of me in other sessions. So I'll take a rest and I'll hand over to my colleague, Novilia. Thank you.
Good afternoon. I'm Novilia from World Vision from Southern Africa, Zimbabwe. I'm going to, for now, I will share more on the hardware components which we are implementing in our washing schools, where we are ensuring access to water and access to sanitation. Okay, as World Vision Zimbabwe, we have different approaches where we are ensuring access to water and access to sanitation. Our sanitation facilities ensures that they are accessible for those who are disabled. Then in terms of menstrual hygiene management, we ensure that the sanitation facilities ensures privacy for the girl child to go in and change and clean yourself. Also, being the on-site sanitation facilities, we also extend water into the sanitation facilities so that I can get inside, change my pads, wash, then get out, clean. We also include mirrors inside so that I can also check myself after I've changed. So we also integrate with the hygiene promotion, where we use the health club approach, where the learners are educated on how to behave hygienically around the school. Through the, for access to water, usually where we operate are rural areas. So the only source of water is boreholes. So we solar mechanize the boreholes so that we increase access points around the school, so that we have a lot of access points around the school where the learners can also wash their hands. So through the school health clubs, learners are taught on how to behave. So to sustain this approach in washing schools, we have since learned that children are the best agents of change. So to sustain it, the children then go home and also share the information they learn at school. Then it has also proved that even the behaviors back home, they change in terms of what? Of hygiene promotion. I will share more on the other approaches which we are using, especially on puberty and menstruation later. Thank you.
All right. I think we can move along to our next. Oh, as a reminder, here's your QR code.
QR code for World Vision. Yeah.
Oh, sure. Oh, yes, yes. Okay, so this, yeah, thank you, Christy. This is a QR code, different than our Padlet QR code. But this will take you to more information about some of the resources that we just heard about from our three speakers related to World Vision's Wash in Schools work. All right, now I will pass it off to our next speaker. Speaking from Sesame Workshop, we have Sophia.
Hello, everyone. Good afternoon. I am Sophia Colas. I am Senior Education Manager with Sesame Workshop. We are a partner to World Vision on our Wash Up and Girl Talk programs, and Swati did an excellent job introducing how that is a behavior change model. So I'm going to spend the next few minutes really diving into the nitty gritty. I think a lot of details that don't normally get discussed in these kinds of spaces. But the points that I really want to emphasize in talking about how we develop our educational materials is our contextualization process. And that process in service of sustainability, ensuring that the materials are appealing to, familiar to, and engaging for children so that they are used year after year and also easy to use and enjoyable to use for teachers as well. In terms of scalability, contextualization of the materials is also important. And as I'll explain or highlight it in a couple of examples, is that depending on the program design or the vision for the program, it's important to think about the national context and how that is reflected in the materials, even beyond the sites of implementation. So contextualization is really part of our entire project life cycle. And a project life cycle, both for Wash Up and Girl Talk, is about 12 to 18 months. And I'll just highlight the specific areas where contextualization really comes through. So when we start any Wash Up project in any new country, we begin with a content workshop. And that's an activity that World Vision really organizes. It's for the key stakeholders of the project. It can include ministry officials from the education space, from the health space, depending on the structure of the particular country, as well as teachers from the target schools and sites of implementation. And at the content workshop, we present the aims of the project, the outcomes, the objectives, and then also a selection of the materials that we plan to use for the project. And in that session, stakeholders will really review everything, give feedback from the specific outcomes. Is this something that they want to keep for the project? Is this something that they want to add, remove, or edit? And then also we'll look at the different materials that we present, and a selection of the materials are here, and I'll talk about that as I continue. But at this particular workshop is where we get the initial round of feedback on what changes do we need to make, what do we keep, what do we remove. Then at Sesame, we take that information, we develop the educational framework, and then we move into content development, really applying all of those changes to each educational material. Then we prepare for a pilot. Typically, a pilot includes 25 schools, which begins with a teacher training. During the pilot period, we also conduct formative research. And what this looks like is us working with a local research vendor who observes typically one wash session. And we normally select a wash session where we've introduced a new material or a new video. And the researcher will observe how children are interacting with the materials. Are they smiling? Are they engaging? Do they understand the activities that they're being asked to do? We collect that information and apply it to the materials again. If the timing works out, we will present those findings at a postmortem activity, which takes place at the end of the pilot, where we get teachers from most of or all of the pilot schools. It can be one representative from each school, and then we get their feedback as well on the materials for a second time, but also how did implementation go? So we can adapt our implementation approach, our training model if needed, and certainly get really nitty-gritty feedback on the materials themselves. Then we go through a couple of months of content finalization, and again, prepare for scale up teacher training or a master training, as Swati mentioned. Typically scale up, at least in the initial wash up phase, is scaling up to an additional about 75 schools, so 100 schools total. This is just an overview of the materials that is included in a typical wash up kit. It's not an exhaustive list, just to give you a sense. You can see on the table, there are quite a few materials here. We have training manuals. Teachers will each get a training manual. We have a number of videos of different formats: storybooks, story mats, slides and ladders, comic books, flashcards. And again, this is just a selection. So in terms of how we actually contextualize the materials, looking at the videos first. So for new live action films, when we introduce a wash up program to a new country, part of the content workshop, as we present the materials, the objectives, stakeholders will look at our entire content, our entire library of video content, or at least a selection that we have sort of narrowed down, at least regionally, for that particular group. And if the stakeholders feel like there's a topic that is missing from that selection or something that they particularly want to highlight in their community, then that becomes the topic and the subject of a new live action film. And that live action film, again, with the support of World Vision, gets filmed in the community, typically in an area where the program is taking place. And then the video highlights a particular wash behavior that has been deemed really important, and then becomes part of the program. In terms of existing video content that gets used in a new context, we go through a process of dubbing and language adaptation. So of course, if we're introducing a new language, we will dub that video content. But even if we're moving from one French-speaking country to another, there could still be some linguistic differences. And what's really important for us to get right, especially for children, is words like germs, poo, pee, sandals. There are a lot of different ways that you can describe those things. And it can often be a very long conversation and sort of back and forth between what ministry and sort of more official stakeholders want you to use as the target words versus what kids will actually understand. So that is also a process that we have to reconcile. When it comes to animation, so the example here, those were the animations that were created for the Girl Talk project in Zimbabwe. That was an interesting experience because at the time there was just this one program in Zimbabwe. So we were able to create from scratch these animations that looked like a rural community in Zimbabwe. Now we're expanding that project to other parts in Zimbabwe and to 4 additional countries. Kenya is one of those, and we're making some small adaptations to what does a tap look like, what does a jerry can look like, but also bringing these same animations to Central America, which requires more adaptation. So swapping out some of the background, swapping out what do the classrooms look like. A couple of limitations with contextualizing videos. For a video that has already been created, you can't actually go back and refilm. So when we present these video assets at the content workshop, there can be a process of selecting which are the ones that resonate with you. If you feel like there's too much adaptation that's needed, we could decide not to include that particular video. With that in mind, for example, there's just a thumbnail here of one of the videos we have on food hygiene and food safety. This was filmed in Ghana, and it features Ghanaian food. Of course, what we also like to balance is if this becomes a discussion, the food isn't localized, this isn't what we eat. What we try to navigate and balance is like, do these key messages still come through to you? If children are watching this, do you think they will still take away? What are the key behavior changes that are needed to make sure that you're practicing good food safety and food hygiene? Another example of a limitation is with a Muppet video, for example, like what's up here, that's an image of Elmo's sandals, and those may or may not be the type or style of sandals that are local to a particular community. That's not something that we can go back and change, at least not easily or cost effectively. But again, we still try to convey if this is still sort of demonstrating the key learning that you need to wear sandals when you're going to the latrine, it's worthwhile to maintain this video. A couple of examples of how we contextualize print materials. This is an example of the first page of a storybook, which I actually have there. That's the storybook from Rwanda. This was presented last year at the content workshop in Kenya, and stakeholders reviewed this and gave feedback on how does this look? Does it look familiar to your context? What changes would you make? And this is the version that we edited for the pilot version. If anyone can spot any of the differences between the Rwanda illustration versus what was adapted for Kenya. You can just shout it out if you see something.
Trees, clothing.
Trees, clothing, outfits, the roof, yeah, so the landscape changed, the houses changed, the clothing changed from just sort of plain clothes to school uniform. The tippy top changed and the latrine changed. And one thing I want to point out also about the style of homes for Washed Up Kenya in particular, there were plans for this project to be national. So you'll notice that there are two different types of homes represented in this image, and that was intentional. So one community or one area that was selected for pilot was a very rural community, and another implementation site was more peri-urban. So we went through a lot of discussion with World Vision Kenya. What are the style of homes that would be appropriate to sort of depict in these materials, but would still be familiar and not alienating to any particular community? So that was intentional. And then lastly, we made one more change for scale up, if anyone can spot the difference here. Shoes, yeah. So after the postmortem, teachers gave us this feedback that even though most children are not wearing this style of shoes, this is what they wanted to depict in the materials. Another example of print materials that we adapt. So this is the story map. It's a large image that goes on the floor, and children will use the icons, stepping on the map. We'll use the icons to tell stories, to answer questions. Thank you so much. So children will basically use this material to answer questions and tell stories, applying what they have learned in the WASH lessons to answering questions and demonstrating their knowledge. And I just wanted to highlight here how important it is to get every icon on this map correct, because children need to be able to identify what they're looking at, what they're stepping on, so that they feel like this is what soap looks like in my home. This is what my slippers look like at home, and things like that. So you can just see the different variations of just one bar of soap, even regionally between Rwanda and Kenya. And these are the scale up icons. So for Rwanda in particular, that icon, used to be blue, it used to not have suds, it had writing on it. So even just like these really minute details are the things that we get really specific about. And then lastly, we also have different adaptations for our wash up programming, depending on the particular context. So we have our standard wash up program, and we have also adapted it to focus on particular needs in the community. So we have a version which focuses on, I'm so sorry, I'm losing my voice, on neglected tropical diseases, on inclusive wash up, which focuses on children with disabilities being able to use and access wash facilities with dignity and inclusion. And then Wash Up Girl Talk, which Nabula talked about a little bit, which focuses on a slightly older age group on puberty and menstruation. And now I'm going to hand it over to Nabula, who will talk about that experience in Zimbabwe and how we're further adapting the materials for expansion. And then she'll hand it over to Swat. Thank you.
Okay, thank you, Sophia. For now, I'm going to be speaking about the Wash Up Girl Talk approach, which is an approach which targets, maybe before I get into Wash Up, also in Zimbabwe, we are implementing Wash Up, the infant Wash Up, which targets ages between 5 to 9. So in a primary school setup, you have learners, early childhood stage to grade 3, which is infant, they do wash up the infant one. Then from ages 10 to 14, they do the Wash Up Girl Talk, which is a puberty and menstruation approach. So they somehow graduate from Wash Up to Wash Up Girl Talk. So for now, I'm going to speak about Wash Up Girl Talk. So Wash Up Girl Talk is a puberty and menstruation approach which we are using as well as in Zimbabwe, and it has since upscaled to other countries, but we piloted Wash Up Girl Talk. It started in Zimbabwe. So with Wash Up Girl Talk, just in a few words, we target schools, we train teachers. From each school, we target about 2 teachers. We take them through the 5-day training where we are training them on how to conduct sessions. So there are 10 sessions. This is the training manual, which the teachers will use to guide them through in conducting sessions. Just to name a few sections within this guide include puberty, where we are now breaking the ground to say we want to talk about menstruation, but we want also to talk about all stages of puberty, because menstruation is not the only puberty stage. So also this approach doesn't only target girls, it targets both boys and girls between the ages of 10 to 14. So this session on puberty breaks the ground, where we say menstruation is like any other puberty stage. So it's the same support the boy child needs on puberty, is the same support the girl child needs. So just to mention a few, there's puberty, there's menstruation, there's also a session on my cycle, which now look into the calendar, where we are now teaching the girls how to count their calendars. We also use the cycle bracelet, both the calendar and the cycle bracelet, for them to trace their cycle. So the teacher goes through the training. Then at school level, the teacher now has to facilitate the sessions. And we've got 2 books here. There's the activity book for girls, then there's the activity book for boys. So the girls will be having each girl will be having a copy, then the boy will be also having a copy. And the sessions in these books, they are not the same, but they are all 10. So there are sessions which are attended only by the girls only. And one of the sessions includes the one on menstruation, because maybe some girls are not free to discuss issues of menstruation when boys are there. Then there's also the session of my cycle where we are now calculating the calendar, but there are some sessions where they combine and have the session together. So in these books also, which are, we call them activity books, but they are also more like a diary. After each session, there is a space for the learner to write what they learned. In the next session, in the following session, then the teacher can also recap or give them homework, give them what to go and ask from the parents. Then in the next session, they recap, then they move on to the next. So also within these sessions, we've got a session on reusable page making, because we also ensure access to what? To materials for menstrual hygiene management. So there's a session where the teacher also takes the learners through how to make a pad. But on this one of the challenges which we have made, I think our target group, they are too young to sew the pads. So it's more like just giving them just that general information. So for scale up on this one, we've also involved the school development committees. We've also involved the mother support groups within the community, so that they also come and assist their learners, or they also have their mother support groups within the community to continuously sew the pads and ensure access to materials for the girl child at school and at home. So that's one of the challenges we've met. Then also on teachers training 2 teachers per school has been a challenge also. We do train, but due to staff turnover, teachers moving from one school to another. So what we have done, 2 teachers will attend the training of trainers. Then when they get back to school, as they are doing sessions to learners, we encourage at least 5 teachers attending the whole session, so that whenever there is transfer of teachers, there is that continuity for the other teachers to continue carrying the session. So in addition to these books, we also have videos which we use. Our learners watch videos to support different sessions. Not all sessions have videos. Some sessions don't have. But some sessions have videos, like one session on how to make a reusable pad. You explain to them, they can also watch a cartoon on how all the steps they do to make a reusable pad. Then the other one, I'll speak to menstruation, where we have the young worried girl asking the other, I'm going through puberty, or I haven't started my menses, what's wrong with me? Then there's that discussion to say people are different. I can start my menses at 9, you can start at 10, but it's still normal. Menstruation is growing up, it's part of life. So we just need to support each other. And after all, they've all gone through the 10 sessions. The last session is on graduating, where we are now saying our learners need to graduate. And in that graduation is also a platform also to motivate other learners to join the next club. It's a way of recruiting the next club. So once the rest go through the sessions, they graduate, then new ones come in, they go through the session, they graduate. So that's how we try to ensure that these lessons, they are ongoing. So basically, I think that's all about the workshop approach. Thank you. Over to you.
Okay, thank you, Nobili, and thank you, Sophia, for doing the contextualization. So yeah, this Girl Talk Zimbabwe and the projector. So I will just continue with the contextualization with respect to Wash Up India program. As you can see on the screen, we have these images which have been painted by the school, by the school teachers themselves, because they loved the concept of Raya and Elmo, and children were fantasized by these characters and they want to relate to Raya and Elmo as themselves. And so, yeah, so these are the pictures with, like, we didn't ask the teachers to do it, but this is what they did by themselves. So it was really nice to see such involvement of teachers and children with them. The first picture here is of a soap bank. So we have the Global Hand Washing Day, which has a soap bank. The children make it from themselves. So even in that, they've made their own depiction of Raya and Elmo. And here, second is a picture of children engaging in a story mat, which is also one of the materials of our wash-up kit. And third one is also soap bank with Raya in it. So yeah, this is more on the contextualization with Wash Up India program. I don't know if this video will play well, but we can give it a try and see how that goes.
ट्रेनिंग के बाद हम लोगों को स्कूल में कुछ सामान प्रोवाइड कराया गया था, जो ये है। इस सामान के तहत हमें ये फ्लिप बुक दी गई है, जिसमें राया एल्मो की कहानी दी हुई है, जिसमें बच्चों को हम इस प्रकार से चित्र के द्वारा बच्चों को समझाते हैं कि क्या इसमें बना हुआ है। इसके बैक साइड पे पूरी डिटेल लिखी हुई है, ये हमारे लिए है, ट्रेनर्स के लिए। और ये पूरा एक बुक है, कहानी इसमें बच्चे देखते हैं चित्र अलग अलग तरह के। उसके बाद एक कॉमिक्स बुक दी गई थी 5 तरह की, जिसमें से पहले
So I hope you guys can see the difference in the dress of Raya here as compared to the one in Kenya, right? So that was white and blue, and here in Indian schools, the government school dress is white and red. So that was like just one of the examples that we want to, the whole idea of this is for children to actually relate to the characters, to feel more that whatever they are reading, whatever they are seeing, it's more in their own context. It's not something new. They're not seeing something new. It's like their own community. So I think contextualization plays a major role in the success of the implementation of the program. So yeah, so
ट्रेनिंग के बाद हम लोगों को
video. So I'll just skip that because we have the display of materials here as well. So I can show you few comic books. So these are the ones which are the bigger display for the teachers to see. So like if a teacher is taking class like this, and if she has to show and read it to the children. So we thought maybe this might not work well just one way. So we have few smaller versions of this, like this. So this will be distributed to children and they can read it in smaller groups. So while the teacher is, sharing the story from here, they can also have an in their hands and see what the teacher is going through about the story in their own hands. So these are small things which we feel that makes a lot of impact when you're trying to reach, children in different contexts in different countries, which is really important. And this is one of the material we don't have here in display. So that's a projector. So all of the kits include one projector, which has the videos, as Sophia has mentioned in a slide. So videos are also contextualized. They're also made up in few videos were there, which are made up in Indian settings in the own community. So, children can relate more, seeing other children being part of that.
सबसे बेहतरीन चीज़ हमें यहाँ डिजिटल तरीके से भी प्रोवाइड कराई गई, जिसमें हमें प्रोजेक्टर के माध्यम से और एक मेमोरी कार्ड दिया गया, जिसमें आप देख सकते हैं यहाँ पर ये एक स्मार्ट जो है पोर्टेबल हमें प्रोजेक्टर दिया गया, जिससे जो बच्चे हमारे थे वो वीडियो के माध्यम से सारी चीज़ें जो 12 सत्र हमारे थे उन सभी 12 सत्रों के बारे में बच्चों ने वीडियो के माध्यम से देखा, जो उनके ग्रामीणांचल क्षेत्रों में बनाए गए वीडियोस थे, और उनको अपने नज़दीक पाकर बच्चों ने अच्छा उनमें परिवर्तन भी देखने को मिला और उनके व्यवहार में जो परिवर्तन आया वो आप सबके सामने भी है। बच्चे उन चीज़ों का इस्तेमाल करने लगे हैं, जैसे शौचालय में जाना तो चप्पल पहन कर जाना, खाना खाना है खाना खाने के पहले और बाद में हाथ को धोना, इस तरीके से साफ सुथरे करके आना, नाखून को काट कर आना, बालों को सही करके आना, इस तरीके की बहुत सारे परिवर्तन जो छोटे बच्चों में हुए कक्षा 1, 2, 3, 4, 5 में, तो वो अब नजर आने लगे हैं।
Yeah, so like we also really appreciated the projector model because I know that of all the behavior change programs which have been implemented in India, nothing has happened where smart projector has been given to a school for teachers to play the video, and children really enjoy these sessions. I mean, they want to see Ryan and Elmo, they want to see children in the community. So this is like one of the most favorite part of the Wash Up Kit program. All right, so I'll now hand over to Megan to siblings.
Thank you, Swati. I just want to make a comment that there are a lot of good questions coming out of the Padlet, and we're trying to respond to a couple of clarifying questions in there. So keep note of your comments in there. We're trying to respond to some because I know we might be running low on time. So I will just pass it over to Megan to discuss some of her work from Splash International.
Thank you so much. My name is Megan Williams. I am the Director of Behavior Change for Splash. And learning about some of these other programs, the process of contextualization, I want to take a step to talk about how Splash is implementing at scale within cities. Since inception, Splash has been focused on working in urban WASH and specifically focused on kids. Witnessing the access to WASH within the wealthy and then around the corner to see that there is a complete lack of WASH for those living in poverty. And with the rural to urban migration, this disparity is only being amplified. So what that means for Splash, for us, the start of this mission was installing water filtration systems across every single government orphanage in China. And that now has evolved to having full WASH plus MH programming in every government school in Addis Ababa, Ethiopia, along with a myriad of other programs, countries that we have worked in along the way. Today, I'm mostly going to talk about our strategy for scale, but I do want to give you a little bit of context of our program. So it always starts with water. We are always ensuring that there is water filtration as well as water storage within the school grounds. We are constructing sanitation facilities, making sure there's facilities for both boys and girls, and with a keen eye on making sure that girls have access to sanitation facilities where they can experience their menstruation with dignity. We have custom designed and manufactured our own drinking and hand washing stations, which we install. And then we've had behavioral nudges, both integrated into those stations as well as within the enabling environment. We have a comprehensive menstrual health program, which hopefully you got to see my colleague's poster yesterday on that, but it involves educating and engaging parents, the peer mentoring program, engaging boys. It's great to see that the Wash Up program has a lot of those corresponding areas as well. And of course, girls at the center of everything that we're doing with that. And then we have a suite of a number of different behavior change programs. We engage janitors to make sure that they are equipped to be able to maintain the infrastructure from a cleanliness perspective, as well as maintenance staff on keeping the infrastructure sustained. We also engage subsidy officials, teachers, and of course, the star of the show, our kids. As Sesame highlighted the importance, we absolutely and spend extensive time customizing all of our materials for the different contexts, whether that is primary students to secondary students or from country to country. And we leverage behavior-centered design, which is from London School of Hygiene and Tropical Medicine, as our methodology to ensure that this process is taken with rigor. But I really loved the Sesame kind of outline and approach, so I'm going to steal some of that language in the future. Thank you for that. So that's our comprehensive program, and that was a very brief snapshot. So if you want to learn more about Splash's actual on-the-ground schoolwork, I am happy to talk about that after this. But what I was asked to really dive in today and what I want to share is more about our scale and our strategy towards scale, and especially looking into the future. So we've broken this out into the 3 Ps to prove our model, to refine it, make sure that it's cost effective, impactful for washing schools, and then to persuade, to convince the governments, the implementers, the schools themselves, the funders, to be able to invest in washing schools at scale. And finally, to phase out, what does it look like to have an actionable plan that is sustainable, ethical, to have transition? So I'm going to dive into this a little bit more. Prove. What have you done to prove your model? What are the necessary data points to assure success? These are some of the questions that we've been asking ourselves to be able to assure that what we're doing is having an impact. So our current project right now is within 2 countries, and it's called Project Wise, Washing Schools for Everyone. It is impacting nearly 1 million kids. So we want to make sure that we're doing this right. And while output data is not going to be an indicator of success towards the impacts, it is a really crucial ingredient to be making sure that what you're doing is scalable, that you're at the clip of pace of doing the work towards your plan. So we collect extensive data to be able to track the fidelity of what we planned for and whether that's being implemented. But then we also go another level deeper of understanding at the site level, are the outcomes that we hope for being achieved? Is the school, is there cleanliness at the school? Is the infrastructure functional? Are students actually washing their hands? Is the clubs active? And then we take that and look at it over time, rather than just doing a pre-implementation and post-implementation survey to see, like, did the program have effect in that moment? We're doing that year after year through routine monitoring to see, is there changes that are taking place that we need to go back and address? All of this effort has really helped to give us some of those proof points that we need to know the success of our program. Next month, we will be at 94% of coverage of all of these government schools within ADAS. We have seen a 22% increase of our hand washing with soap through observing students. Been reported a 17% reduction of self-reported respiratory illness. And some of the indicators that aren't always talked about, but I think absolutely crucial and important, is we have also seen a $9 million investment from the government to contribute towards this, as well as a decrease of cost on a per student rate at 30%. We're always trying to improve upon our program and make sure that it's cost effective, which then has huge impacts on scale. I wanted to pause though and honor Jenna's request to step outside and talk about the failures, because that number of $9 million of co-investment, that's something that Splash is very proud of. We are so excited that we were able to achieve that. But the start of this program was in 2 countries, in India and in Ethiopia. And we invested our implementation and time by doing our work in India with the anticipation of securing those funds in India. And after years of our investment, it became clear that this just, it wasn't looking like that was going to happen. And so unfortunately, we had to come to a point of an ultimatum of, are you going to invest in this? We clearly are coming to the table with a lot to offer. And sadly, they did not. And we made the really hard decision. We dragged our feet a little bit, but we did make the decision to close. And we really learned that lesson, that the government co-investment has to come at the start, and you have to have benchmarks along the way if you're trying to do a project that's at the type of scale that we're trying to do, which is entire citywide coverage. That said, we were able to shift those resources towards the second city in Ethiopia, to Bahadar, and we were able to secure co-funding for that as well. And so we're able to have that full WASH plus MHM programming in a second city in Ethiopia, which was a success at the end, but a hard lesson to learn. So how have we done this? What are some of kind of the tactics to be able to achieve these proof points? Well, we had to start with a large global team, being able to set the standards and have specialists to be able to uncover what are the ingredients to have this program work at scale. We had in-house design along with a lot of consultants to help us. We don't claim to have all the answers. And so we really had to pull together a lot of brilliant minds to be able to come up with our solutions. We did direct implementation, having an INGO presence on the ground in these different countries so that we were doing the work ourselves. And then also having a dedicated MLE team. Again, it's just so important to have that constant feedback loop so that we could be seeing where are our gaps, where could we amplify and invest more time because it was successful. But this is not the modality that we want to keep using moving forward. We do not want to just continue to grow our footprint. And so our next tactic is persuasion. But what do we need to persuade? Who do we need to try and persuade? So our next phase is trying to create a web of partnerships so that we can expand this Wash in Schools model to four additional countries and 2 to 3 cities per country. But again, we don't want to do that by setting up full Splash teams in each of these countries. And so we are looking to persuasion and our charm. We want to continue this effort of persuading governments to invest in this program, to persuade organizations to partner with us, local suppliers to meet the needs and demands of what we are requesting by making a massive shift in their cities. And of course, persuading the schools administration, the students, the parents to engage and be involved. How do we plan to do this? It always has to start with information. So our first step is collecting citywide data to be able to really know what is the landscape of what we are entering into. How can we better plan for the budgeting and what is actually required to achieve this? And then hand in hand with government, not making that mistake again, making sure that they are involved from day one. Expansion through indirect implementation, having a cohesive team of partners, and it can be a variety of partners, some that specialize in menstrual health, and some that specialize in infrastructure. And then in that, having more of a co-designed process. And I'm really excited for this part, to be able to share what we've learned, but learn from others. Having a redesigned global team that specializes more on learning and program design, and then of course, a smaller local team because we would not be doing the direct implementation ourselves. The final one, phase out. What does an ethical and effective close look like? For Splash, because we do not want to expand our footprint, we are hoping to be able to create a set of tools that can be leveraged by others, that we can help in the adaptation of new contexts, and really leveraging our experience in direct implementation, partners' experience, and having that web of support and success so that local organizations can thrive and do a far better job than we could ever do. Now, some of this ambition and hope is far in the future, but we really see it a crucial thing to be able to approach today with the foresight of tomorrow and make sure that we are setting ourselves up and the sector at large to achieve those lofty SDG goals. So how are we doing this? Well, by having a multi-city, multi-country approach, we are creating a platform of diverse contexts and examples, which can then be the launch pad for other organizations to replicate. Also having a knowledge management hub, creating clear, engaging, fun ways to understand these materials, shifting our modality into more of consulting so that we can help others succeed. And then finally, funding and actually being that bridge of helping to connect funders with local organizations. All right, thank you so much.
Thank you, Megan. I will waste no time and we'll just pass it straight to our next speaker, who is Gracie from Stanford University.
And fun. We all thought of her having Swati. And we all won. She explained to all of us.
I hope you all are not tired.
But my name is Gracie Quincy. I'm a PhD candidate at Stanford University, and I've had the privilege of working with Swati on the evaluation of Wash Up India. And I'm thankful to go after Megan, and that she set up this really nice framework of proving and persuading and then phasing out. Because I can say today that we are in the proving stage. This is an impact evaluation, so we want to measure the impact, but that does not mean that there have not been challenges along the way, of course. So once again, I promise we will also be talking about challenges today.
All right, so as you all know, we are implementing the program in India. So it's in Sitapur district of Uttar Pradesh, one of the 28 states of India, and it's more on the northern side of India. In Sitapur, we are targeting on 200 schools. So it's a small number as compared to the number of schools which we have in Sitapur. So 200 schools are spread across 5 blocks, and Sitapur itself has around 19 blocks. So it's an intervention which we're trying and seeing if it's scalable to other blocks and other schools as well.
And so this is a diagram for the O&M. Whoever put the O&M question in the Padlet, we are here now. We are here. But this is the O&M model that we are currently testing alongside Wash Up India. So Oxford Policy Management is an in-country partner who's acting as the contract holder for Sing Security Agency. You might be like, why is there a security agency here? We'll talk more about it later, but they have been willing to transform some of their business, and they're now also acting as a cleaning agency, and they manage our team of Swachhta Sathis or cleaning buddies that are cleaning in each of our 105 implementation schools for the O&M model. So flowing from Oxford Policy Management to Sing Agency would be, first of all, money. They're holding the contract since he is providing a third-party service for us, but also accountability. We'll talk more about some accountability mechanisms written into that contract. And then flowing from Sing Agency to each of the schools, there's of course a Swachhta Sathi. There's one cleaner at each school. He's also in charge of provisioning relevant cleaning materials for these workers, and then is also supposed to monitor progress. So he's providing kind of a whole suite of services. To talk just a little bit more about the services that are being provided in schools. We focus on 3 main pieces of WASH infrastructure. So it would be the drinking water source, which in most of these schools, that is a hand pump, a hand washing station, and then the toilets. And we've really tried to hone in on toilets because we found in our formative work that you need strong incentives, especially in the cultural context of India, to get people to consistently clean toilet facilities. So when it comes to the hand pump or the drinking water source, their responsibilities include cleaning around the source and making sure that the path to it is clear, and then reporting if there is non-functionality to the headmaster or a relevant person at the school. For the hand washing station, again, cleaning around, making sure that the path to it is clear. Some of these stations need to be refilled with water. It's like a bucket and tap system. They're responsible for making sure that there is water regularly available. If the school has soap, they are supposed to report if there is not soap at the hand washing station. And then once again, if there is non-functionality, it is their job on a daily basis to report that to the headmaster. And then for toilets, this is where we really tried to have special focus, but they're supposed to clean in the toilet pan with disinfectant. They're responsible for making sure if the school doesn't have a running water tap, again, that there are bucket and mugs and that there's water available for proper cleansing for students. And then again, reporting non-functionality. And so, okay, I promise that we're gonna talk about the good stuff a little bit more, and we're gonna talk about challenges very shortly. So we did try to design with scale in mind from the beginning of this intervention design process. And I want to again shout out Oxford Policy Management. They couldn't have a representative here, but they co-designed all of this with us, and they deserve lots of credit for this formative work. So with the third-party contracting model, this was very intentional. Instead of whether it be a World Vision or an OPM or a government or another NGO holding individual contracts with every Swachhta Sathi, this is instead funneled through a third-party agency. So then if somebody were to take over this contract, they're taking over 1, not 105. So that was designed for scale. And then also thinking about transferring this to different markets, we do feel that with proper due diligence, that this would be able to be implemented in other markets, similar markets in India. And then part of this proving process that has been kind of an added benefit is that we are building capacity with this agency through the process of him implementing in these first 105 schools. It's also, he's learned how to do this much better for the future because we hit a lot of bumps in the road. But so through this proving process, being able to build capacity has been a real pro.
And a very important aspect of the intervention is to have the government interest from the very beginning, because if we don't have the government in alignment with our intervention, it'll be really difficult to scale it up if they want to have it. So we have the government interest in alignment with us, and also we are targeting on the government priorities. So the national government focuses a lot on the Swachh Vidyalaya Puraskar. It's a cleanliness school award, which is run every year in India. So operation and maintenance of the schools and the facilities and the functionality of it plays a very important role in that survey. So our intervention aligns well with the government priorities as well. And I will just skip this video and see because we've seen how it's going. So yeah.
But in short, so this was 2 block education officers from Seat Support District, and we can also give a summary if you'd like, but pretty much they have been fans of the program so far. They feel that they're seeing positive changes in their school, and anecdotally, they feel like student behavior is also changing as a product of access to cleaner facilities. Okay, and now this is where we start talking about some challenges. So we hope this is a safe space to talk about our challenges together. So first, from baseline to midline, the agency worked quite imperfectly, but with schools to find enough cleaners to provide to these 105 schools. However, they really required quite a lot of support from the implementation team within Oxford Policy Management to make these connections with schools, considering he was more used to working with malls or larger organizations before this instead of individual schools. So that required quite a lot of facilitation. Similarly, for procuring correct supplies, Swati will mention more about this later, but Seat Support is a relatively small context. And so being able to procure the right supplies and enough of them, he just didn't have the right relationships at first. And once again, this required lots of facilitation on the side of Oxford Policy Management. So moving to towards midline to endline, we were trying to keep scale in mind, and we really felt that this implementation team needed to take a strong step back from this heavy facilitation. We recognize that if somebody is going to take on this contract in the future, they are probably not going to be willing to employ up to 5 people at any given time to make sure that one agency is doing the job that is specified in their contract. So I mentioned before that we had these penalties written into the contract of same agency, and we had to be willing to take a step back and actually let those penalties either do their job or not do their job. And I'll say that this has been maybe a failure on the side of some of Stanford's communication, because we've heard from our team in country that they're quite afraid to kind of levy some of these penalties, because what if he backs out? It's going to, the study will be a failure. And we should have been able to clarify that on the front end, that would not be a failure. The intervention not working is not it failing, because that means that it is doing what it will do in the real market. And so I will also talk about kind of that competition aspect in just a few minutes. So we're going to go to more challenges now, actually. So our first lesson here has to do kind of with timeline. So when we're thinking about employee onboarding, a research timeline might look quite different from what a business would want their timeline to look like. For us, we really needed our implementation to all start at the same time. And so we weren't at risk of outside factors disproportionately affecting some schools that started their implementation earlier. We felt it was important to start all at the same time. However, this meant he needed to onboard and find supplies for 105 employees at one time. So this caused a lot of logistical difficulties, and he's maybe reported on the back end that this had impacts on his budget that he was not aware of. But I think looking from the Stanford side, what I really see is that this maybe started a lot of this very high touch monitoring or hand holding that then was a really difficult cycle to break later. And so I think he was going to add a little bit about the C2 context as well.
Yeah, thanks, Tracy. So when we were doing this intervention, it was quite difficult because Sitapur itself is like a small town. It's near to the state capital, Lucknow, but still in terms of getting the resources and 100 Swachhta Sathis on board and dress materials, the boots, the cleaning materials. So it was quite difficult for the Singh agency to get it all at once. So maybe when it's done practically and when we are implementing this in different settings, it's important to note that timeline and keep in mind that, you know, what kind of resources would be needed and what time we need to allot for that. So that's necessary while implementing the project in a practical setting. Yeah.
And the last point that we wanted to touch on was the point of competition. I think that we all hear about capacity building as a necessary and I would say very often a net good thing that we can do with partners in country, particularly entrepreneurs that we work with. And so the implementation team at Oxford Policy Management, while they were doing this facilitation, it was building capacity. Over time, implementation became much more smooth, and there was, gradually a bit less hand-holding that was needed. However, in doing this, in the C2 context, we also ended up kind of creating a virtual monopoly because now this was the only partner who was able to implement at the scale that we were wanting to implement at. And this is ultimately what was driving the in-country teams kind of fear or anxiety around using our accountability mechanisms, these financial penalties. So while it was really great to elevate and build capacity here, we maybe needed to be more conscious of the market that we were implementing in to make sure that our accountability mechanisms were still relevant in that market. And to make sure that we still have a little bit of time for questions, we're just going to quickly run through our key points again, which is that our formative work was really important. Knowing what there was demand for and where the major barriers were, which was toilet cleaning, was really important. But if we could go back, maybe we would include something like a market assessment to, since we're working with an entrepreneur, understand both the barriers and enablers that he's working with. Again, with government interests. Swati won't brag on herself, but her team has done a phenomenal job of meeting often with government officials, even though they are notoriously hard to track down. But if you've been able to see the videos, it's really paid off and that they are very interested in hearing the outcomes of the study. And then government engagement again. We are not way out in left field doing something that the government is not interested in. With the implementation of Swachh Vidyalaya, the Clean India, Clean Schools, we are operating within an area that the government is interested in. And I think that that's just, it's an advantage that we can leverage as often as possible. And then again, the market limitations, recognizing the limitations of the market that we are operating in, because that does not necessarily change when we scale, and those problems in fact might just become larger with scale. So maybe if we could go back, that is something that we would think about more. And thank you so much for your time and your attention today. Luckily, I do think we have about 10 minutes for questions, so I'll welcome Sydney back up, our expert moderator.
Thank you.
All right, a huge thank you to all of our speakers. I know that that was a lot of content to try to share, and we've had some really great questions going on in the Padlet, and a couple conversations in the comments as well. So it's a tricky job for me to try to choose just a couple here that we can respond to. But in terms of questions that I think we could hear from all of our speakers, or a good number of our speakers about, we've been talking a lot about contextualizing programs for scale, but there's a question in the Padlet about what is the difference between scalability and replicability? How would you recommend one over the other? And is there space for both in our Washing Schools work? So I'll direct that at all of our speakers. If anybody wants to chime in first, maybe 3 or 4 of you can respond.
I don't know. Let's try.
Sounds like it does. Hi. I'll just speak from my perspective, and I'd love to hear from
from others. I think, you think about replicability, which is a hard word to say. You like copy and paste, right? Like pick it up here and put it over there. For me, I think that can be valuable, particularly in areas where there's a lot of common geography, common context, even common staff who are implementing and working with people. I think the further and further out you go, the harder and harder that is without at least taking into some account for context. And I think that's something I assessed, Sophia, really highlighted in the importance of, what can we apply that's worked elsewhere and what do we need to change? And so I think I would be hesitant to say replicability works beyond kind of a pretty discrete area without some respect for context. I think for scalability, that's almost like how does something then become contagious, right? And multiply, which to me is a much more different thing. It requires local ownership, requires including all stakeholders, including children from the very beginning. It includes making sure it's not, World Vision or Splash or whomever coming in and saying, this is what we want you to do, but it's like, well, how can we do this together? And that's something we're learning to do better as an organization. It sounds very much core to what Splash is doing. So, but it has to be something that is adopted and owned by those who really are the duty bearers there and the ones who carry it forward. So that's all.
Yeah, I think the only other thing that I would add to that is thinking about the sustainability and the cost that like Jenna was highlighting at the beginning. And for replication, I think that can be done with a lot of money, and it doesn't have to be something that is cost effective if you just wanted to have an organization replicate. But if you want to replicate at scale, then it has to be really cost effective and eventually sustainable as well. So that's the only thing.
No more things? All right, I've got another question here that's kind of a sum of a couple of questions here in the Padlet. But we've already heard a couple distinct examples of how this is being implemented, how wash-up programming is being implemented in India and in Zimbabwe. But we also have a couple colleagues here that just more generally work in Washington schools across broader contexts and might have other insights to bring as well. So the question I want to pose to our speakers here is, in your experience, is there any specific management model that has been most successful for Washington schools? Are there general best practices that can be applied more broadly, kind of again, getting at this replicability or scalability question? And another question to add on to that is there a community role in sustaining these Washington schools programs? So feel free to respond to any of those questions.
Okay, thank you for the question. I think what we have tried and maybe yield some results a bit is we do water-related interventions where we are installing a solar pipe water scheme at school level. We've tried to integrate with other sectors. I would speak into the livelihood sector, where we then now capacitate the school development committee on how they can use that water to economically empower the school structure, the school development. How can they use the available water to make money so that they can now also address other issues around sanitation, around hygiene, and also to maintain the system to be sustainable. I think that's one thing which we've also tried to work with a community, with school development committees, which are really forthcoming and active. It has worked because with school with enough land, they can have a 1 hectare garden. They do vegetable, then they can sell in a continuous way. They are able to maintain their system. I think I'll share that one.
Okay. So yeah, thank you for the question on like what role the community has when implementing a Washington schools program. I think it's really important for the community to be aware of what programs are running in the school, because we had this challenge of, where we upgraded the wash functionalities and the services, and because school is open for like 6 hours. And after that, it's to the community. And especially in India, all the schools are in the communities. So school is surrounded by houses all around. And after the school hours, there have been cases where, the community people might break in, and there are cases where the toilets get broken, or the hand washing stations are broken, or the taps are stolen. So it's very important whenever implementing a wash and school program, if you have a community, it's necessary to have few community engaging programs as well. So due to the limitation of time, I could not include it in the slides, but we make sure that whenever we're implementing wash and school, we strengthen the local school structure, which includes the child cabinet, the school management committee. The school management committee has representatives from the school, from the community as well. And we also focus on few engaging programs in the community during special days like Global Hand Washing Day, World Toilet Day, World Water Day. So it's necessary to have that engagement all throughout when you're running the program, so that the community is aware that, it's their own children who are going to the school. It's not your or mine, it's their own students. So they have ultimately a responsibility to help maintain and sustain those wash services. So yeah, I think that's important. Thank you so much for that question.
Anybody else want to respond to that one?
Can I just say? Okay, also as we design the water system, find the direct beneficiaries of the school. But you also, if there are, as such as said, if there are households and communities around the school, extend the system to that community level. And if I'm getting water from that standpipe, from finding direct from the school, I will take care of that system. Because whether it's vandalized, I'm also affected at household level. So at least we have standpipes within the school, but also have some standpipes scattered around the school, benefiting the community. So that the loss, if the solars are stolen or the pump is down, someone can really feel it. And then someone will be responsible to say, I have to take care of this system, then it's sustainable. Thank you.
All right, we've just got 1 minute left, so I think we'll close our Q&A there. If you have other questions that come up, feel free to put them in the Padlet, and we'll try to see if there's any others that we can respond to. I do want to call out, we have some materials up here at the front table. We referenced a couple of them during our presentations, but please feel free to stick around for a couple more minutes and come and interact with some of these materials. All of our speakers will be around as well to answer any additional questions that we didn't have time to get to. But please join me in another round of applause for all of our speakers today. We're comforted to hear about some other challenges that people in this field are facing, but also hopeful for some of the success stories they shared as well. So thank you for coming today.